Yep. Did I take you to say a moment ago that amongst the measures that you think should have been instituted in that early period, we've been through a number of them, was that face covering should also have been something that was recommended or mandated by government?
Yes. So I think if we looked at other countries, they moved much quicker towards at least recommending to their publics face coverings as a way to protect themselves. And even on top of that, certain level masks, so medical grade masks. I think sometimes in Britain, we debated for too long, do masks work? Instead of going from in clinical settings they work, surgeons use them, on construction sites, the mask itself works. It's how it's actually used at a population level, which does it affect transmission dynamics? But it came back to there were not enough masks. There was not enough PPE, even for doctors going onto COVID wards. So how could you be recommending it to the public if people in a hospital going onto wards weren't able to access at enough level the appropriate kit that they needed? And so I think and I've kind of reflected in my statement that I think we should have acknowledged more that some people don't like wearing masks. They see it as an infringement on their freedom. And I think those views are very important to have there. But that's a separate question to do masks work. The question is, are masks an appropriate intervention given the cost-benefit calculation at where we are in this pandemic, in what groups and in what settings? And I think if we had moved there, we could have had a helpful debate on how we reach the guidance rather than do we like masks or do masks work? With people who are pro-mask saying, well, you're being selfish not wearing one, and people who are not wearing a mask saying they don't work. That wasn't helpful. I wish we had been more constructive in thinking through when we recommend them to people, in what settings, what they're able to do, and then actually getting the masks in, because that was a problem. The PPE was a huge issue.
To summarise, you've said quite a lot about this in your statement very helpfully. My understanding of your position is that you are an advocate of the application in this regard, in these circumstances, I think of the precautionary principle, that it would have been better to have wasted less time on scientific research trying to get to a level of something near conclusive proof that masks worked, and it would have been better simply to have got on with using them, which, as I understand it, you think would have made a difference. In particular, you say in your statement, to the number of deaths that were suffered over that period.
Yeah, I think especially in the months before we had scientific tools, that means therapies, vaccines, even appropriate testing that took a long time to get up and going. These were things that you could recommend to people to limit transmission. They are flawed. I know, you'll find studies showing that masks at a population level are often not used correctly. People wear them over their mouth, not their nose. They take them off to eat and drink. But as a whole, we do know that if it's used appropriately, it is probably one of the best interventions you can use to protect yourself. So it would have been another tool.